Hello, my name is Stephanie Steiner, and today I will be discussing emotional intelligence and leadership in patient care within the field of nutrition and dietetics. In this presentation, I'll discuss how emotional intelligence can enhance leadership and improve patient outcomes. Emotional intelligence is the ability to identify, understand, and manage your own emotions, as well as the emotions of others. In nutrition and dietetics, emotional intelligence enhances patient communication, improves team dynamics and collaboration, encourages culturally competent care, and contributes to personal growth. There are several leadership theories that integrate emotional intelligence. However, today I will focus on Goleman's model and transformational leadership. Goleman's leadership styles include different approaches such as coaching, democratic, and authoritative. While transformational leadership is about motivating and inspiring individuals to exceed their own expectations. This leadership style focuses on understanding the values, needs, and concerns of those you lead and care for. Goleman proposes 5 key competencies in emotional intelligence. Self-awareness, which is regularly evaluate your emotional reactions and their effects on your decisions. Empathy, which is work on understanding patients' and colleagues' perspective. Social skills, enhance your communication strategies to resolve conflicts and build positive team dynamics. Self-regulation, control your emotions in high stress or emotionally charged situations. And motivation, keep your personal goals aligned with patient outcomes. In our first scenario, we will be looking at a patient who was recently diagnosed with type 2 diabetes. Her cultural background includes dietary habits that are high in carbohydrates like rice, which is a staple in many traditional dishes. While managing her diabetes is critical, her diet is deeply tied to her cultural identity, making it difficult for her to adjust her habits. This is an example of transformational leadership. As a transformational leader, you would use empathy and cultural sensitivity to inspire the patient with her treatment plan. This leadership style allows you to build a trusting relationship by demonstrating that you understand her cultural needs while also guiding her towards healthier choices. Key competencies that should be considered is self-awareness, to recognize your own personal biases or assumptions. Empathy, try to understand emotional connection to traditional diets. And social awareness, respect those cultural values and dietary recommendations. Strategies that could be used for this scenario include active listening. Take the time to listen to the patient. Learn the dietary traditions and cultural significance behind them. Listen without judgment. This not only builds trust, but also shows respect for their background. Collaborative goal setting. Work with the patient to make a personalized dietary plan and SMART goals that maintain their cultural practices while meeting their health goals. By involving the patient in the decision-making process, they'll be more invested in the outcome. Then focus on patient education through cultural relevance. Provide educational resources that are culturally adapted, that offer practical suggestions for modifying traditional recipes. So tools and resources that should be considered. Cultural competence training. Participating in these types of programs can deepen your understanding of diverse cultures, allowing you to build a stronger, more respectful relationship with patients. Motivational interviewing. This is a patient-centered approach that encourages patients to voice their concerns and find their own motivations for change. Culturally adapted dietary resources. Access and utilize meal plans and food substitution lists that honor cultural preferences while still promoting healthy choices. Our second scenario is a clinical dietitian that is dealing with a conflict between 2 team members on how to effectively manage a patient's needs. This is not only affecting team dynamics, but also negatively impacting patient care. Goleman's democratic leadership style may be most effective in this situation. By encouraging open dialogue and collaborative decision making, it allows for integration of both perspectives. Key competencies that should be considered in this scenario include self-awareness, your ability to manage emotions during conflicts; social awareness, your ability to understand stressors and team dynamics; and then relationship management, which is the ability to facilitate conflict resolution. The following strategies may be helpful in navigating this conflict. So, open dialogue, creating a safe space for the team members to discuss their differing views. This will help them both feel heard and respected, which can reduce tension. Conflict mediation. As a leader, you must act as a neutral facilitator. So help them recognize their strengths in each other's approaches and guide them toward a solution that combines both approaches. Then collaborative decision making. You need to shift the focus away from the conflict and consider these tools when resolving team conflicts. Conflict resolution training. These programs help provide structured approaches to mediating conflicts. Emotional intelligence assessments. This can help measure and develop emotional intelligence within teams, encouraging better communication and conflict resolution. Then collaborative platforms, utilizing tools and platforms to maintain open communication among team members so that issues are addressed in a timely manner. One of the most important tools for cultivating emotional intelligence is self-reflection. So ask yourself these questions. How did I respond emotionally during that interaction? Did I allow personal biases to influence my decision? And how can I develop more empathy in these situations? Methods for self-reflection. Self-reflection practices. Set aside time after significant interactions to reflect on your emotions and your responses. Peer feedback. Seek constructive feedback from colleagues to gain insight on your emotional intelligence and leadership skills. Emotional intelligence workshops. Participate in workshops that focus on enhancing emotional intelligence and self-awareness. Our key takeaways is to practice self-awareness. Regular self-reflection builds greater self-awareness. Empathy. Develop stronger connections with both patients and colleagues by prioritizing empathy and cultural understanding. Lead with emotional intelligence. Whether through transformational or democratic leadership, emotional intelligence can guide your interactions and improve outcomes. And culturally competent relationships. Understand and respect the cultural backgrounds of your patients and adjust your care to reflect that understanding. Emotional intelligence is a skill that we must practice to cultivate. By continually developing these skills, you'll improve not only as a leader, but as a healthcare professional.